Hey everyone, happy October. I hope you all are having a good month so far. I'm glad that the weather's getting cooler. I'm going to be back talking about my monthly topic this month for the diabetes class. And this month I wanted to talk about nutrition when it comes to like healthy eating and exercise with diabetes. Since exercise is a huge component for blood sugar management and just overall health, I just want to make sure if you exercise, you do it in a safe way to manage your blood sugars. So I think everybody is aware that there's a lot of benefits when it comes to exercising, but when it comes to patients that have diabetes, it has even more benefits because it helps the patient become more insulin sensitive. On top of that, besides managing your blood sugars, it'll help with your overall fitness, help with weight management, reduce risk for heart disease and stroke, and then it also just helps overall well-being. There's a lot of benefits when it comes to exercise, but I just want to give tips so you can exercise in a safer way so you don't have too low blood sugars when you do it. So for many people, a recommendation is 150 minutes a week of moderate intensity exercise, and that's the same for patients that have diabetes. And that means getting your heart rate up to about 50 to 70% of your max heart rate, where you're just a little bit shortness of breath, might be able to have some words but not have a full conversation. This includes like maybe some brisk walking or, swimming or biking, just something that gets your heart rate up a little bit. But it's important to be checking your blood sugar before, during, and after your exercise. And it's also recommended, spread out your exercise. Don't exercise all in one day, but try to spread out maybe 30 minutes, 5 times a week, just so you can consistently have that and not have one big burst of exercise, but just spreading it out. So here I have a guideline sheet for blood sugars and then exercise. So if you check your blood sugars and it's lower than 100 milligrams per deciliter, then definitely wait a while. Have one portion of a carbohydrate snack. Preferably have it like an easy digestible carbohydrate, like a piece of bread, banana, something like that. And then wait 15 minutes, check it again, and if it's above 100, then you can start to exercise. On the other hand, if it's between 100 to 250, it is safe to exercise, but then maybe wait and check it another maybe 30 to 45 minutes, see if it's still in that range, but that's your safe zone to exercise. And then if your blood sugars are too high or if they're over 250 milligrams per deciliter, it might be unsafe to exercise. If you have something to check your urine for ketones, then go ahead and do that, but maybe have a glass of water, walk it out. Might have to take even some insulin if you're on it, if it's above 250 milligrams per deciliter, just because that is really high and there could have some dangers for exercising with it. But your safe zone would be 100 to 250 milligrams per deciliter. Go ahead and exercise in that range. So when going back to if your blood sugars are below 100 milligrams per deciliter, you follow the 15 by 15 rule. That's 15 grams of carbohydrates and wait 15 minutes to recheck your blood. So up here I have different snacks that might be a good option to have if your blood sugars are too low and you are wanting to exercise. So you might pick one of these options and then wait 15 minutes and check your blood sugars again. And some options I have on here would be like 12-ounce tomato juice, preferably low sodium, a small piece of fruit, a 100-calorie bag of light popcorn. Just to go over some other, like yogurt would be an option, granola bar, like sugar-free Jello with some Cool Whip. There's a lot of different options, but sticking to like an easily digestible carbohydrate small portion snack is ideal. And trying to have a snack with maybe a little bit of fat or protein or fiber, something that will help it digest a little bit slower than, say, if you had straight like juice, which would be a little bit too digestible. That would be ideal, so this way your body can break it down a little bit slower and you can have a safer form of exercise. So here is a chart that goes over the carbohydrate replacement during physical activities. So if you're only doing like a mild to moderate form of exercise, like like just walking, light walking, or maybe doing some gardening or light housework. If it's going to be less than 30 minutes, you don't really need a carbohydrate snack. If you're going to be exercising moderately, so that's like increasing the heart rate like to 50 to 70% of your maximum heart rate, and you're going to be doing that for 30 to 60 minutes, you'll probably need to have like a form of carbohydrate, like one portion each hour. And then if you're doing high intensity exercises, so if your heart rate is going to be above your 70% max heart rate, and you're going to be doing that for 60 or more minutes, then you're going to need to have like 2 to 3 portions or 30 to 50 grams of carbohydrates each hour. And you might even have to have like fluid replacements, like with Gatorade or electrolyte replacements as well. So just keep that in mind. So let's also talk about insulin guidelines for exercise. So if you're only going to be exercising for less than 30 minutes, you don't need to adjust your insulin. And then if you're going, we talked about adding in the carbohydrate portion if your blood sugars are going to be less than 100 milligrams per deciliter. You don't need to have a additional carbohydrate if you're not receiving insulin or secretagogues. So your blood sugars would not be affected as much. But if you're going to do prolonged exercise, have that carbohydrate portion. For moderate to strenuous activity, which is going to be greater than 45 to 60 minutes, and if you're on that short or rapid acting insulin, decrease it by 1 to 2 units. Otherwise, your blood sugars might drop too quickly because exercising uses up your carbohydrates. And then if you're going to be doing prolonged, vigorous exercise, that's like greater than your 70% heart rate maximum, you may need 15% to 20% decrease in total daily insulin dosage. You can always check with your doctor or physician, see what they would recommend, but it's up to the patient, checking your blood sugars continuously, adjusting insulin, or adding in carbohydrate snack to make sure that those blood sugars are within a normal range. So I hope you found today's video helpful if you're starting an exercise program or wanting to get more physically active and you're needing help with managing your blood sugars or knowing what to do to exercise in a safe way. If you do have any questions, comment below. Otherwise, I'll be putting out my video again next month for the next diabetes topic. But thank you all for listening, and I will see you guys next month.